I think I started to realize that the medical profession wasn't really what I had anticipated within about my first week.
You know, they talk about informed consent in medicine, but I don't know if it's necessarily true for when you're becoming a doctor.
Do I think I'm the same person I was when I started medicine? No, not in the slightest, not in the vaguest.
Mental health in the medical profession receives limited attention at best. Yet doctors are 2.5 times more likely to commit suicide than the general population, and physician exhaustion is a leading cause of medical error. With long working days, time and emotional pressures, institutional inefficiencies, and the perceived lack of support resources, physicians and other clinicians are at a high risk for burnout.
My typical day, I wake up at about 5 o'clock in the morning. I have quite a long trek to work because this place is where I could get a job. Then I get to work. We start pushing cases, one in, one out after the other.
Preparing to see patients, seeing patients, figuring out issues they have, paperwork, social issues, a lot of small demands on your time that actually build up quite surprisingly.
One of the important things to remember when it comes to the day of the life of a doctor is that there's no time for anything. There's not enough time to finish your work, there's not enough time to eat, there's not enough time to sleep, there's not enough time to learn.
So like, who doesn't want to be, the stoic person who's been on their feet for 36 hours and takes on one more task? But I don't think that's not real. Like, it's not real coping.
The 2018 Medscape National Physician Burnout and Depression Report, a survey of 15,000 physicians from 29 specialities, found 42% of physicians feel burnout, while 15% reported feeling depressed. The reasons included financial pressures, bureaucracy and admin pressures linked to their work, long work hours, and lack of respect from peers.
So there are many factors that put a toll on me as a doctor.
It is frustrating when bureaucratic matters, jar you and prevent you from doing what you can. A lack of medication, when there isn't a shortage, when it wasn't ordered.
We have staff shortages. We don't have the capacity to care for our patients.
Tell a family their 19-year-old has died when she was walking around at school 3 days ago, and then feel that suck everything out of you, and then turn on to the next thing.
And instead of you having the time to vent about it or process it, you just push it to the side, keep going because you know you have another 12 hours of work to go through. And so you just push everything to the side. That's what everybody's doing.
And it affects us psychologically, emotionally, and people become jaded.
The scariest kind of red flag for me was not caring and just going through the motions. You're no longer invested in what you do or how you do it. You're invested in getting it done. And there was one particular morning where I just couldn't go to work, and I couldn't pick up my phone to say I'm not coming to work. Like, I just had nothing left in me.
The level of doctors not being able to cope is more than any doctor knows. I think because nobody talks about it.
There is extrinsic pressure from others to, oh well, we went through this, and so it was we've come out okay, and so you kind of just got to get through it yourself. And there is also an intrinsic pressure in oneself to kind of just keep moving.
If I had to take time out to be able to deal with my stress, then I'd be putting burden on the entire team, because it's not about you being ill, it's about the fact that if you take a day off to heal and to get better, you are burdening your entire team.
It's more often the case that there's no explicit expression of this is the system, or this is the support network, this is the protocol.
People believe that for the team of doctors to be strong, everybody needs to be strong. Everybody needs to put on a brave face. do their work and pull their weight.
When you are operating in this tunnel-like vision mindset, many things fall by the wayside. Relationships, family, mental health, physical health, all of those things can absolutely fall by the wayside for the sake of pursuing this goal.
The COVID-19 pandemic has amplified the importance and necessity of frontline workers around the world. It has started to open the narrative to expose the realities of many healthcare workers serving their communities. The Atlantic Institute, the South African Depression and Anxiety Group, and Tekano Health Equity are developing an initiative to create awareness and start much-needed conversations about mental health issues in the medical profession, especially for medical students and young doctors. The initiative aims to garner support from all role players in developing the coping strategies, tools, and reforms needed to maintain resilience and good mental health as a medical practitioner.
I think if I had known what challenges I was going to face before I faced them, I would have been able to deal with them so much better.
There needs to be space within a medical curriculum for us to reinforce healthy mental coping mechanisms.
And I think there needs to be time put aside for each team to speak and reflect on the week or the day that they've had. It's about having conversations, but also about creating the space to have those conversations, because it's easy to say doctors need to speak about these issues, but when? With what time?
These are not challenges that are unaddressable. These are not lofty goals. These are not, we don't want to change the system. This is just, basic logistics. And it adds up. Yes, we need more doctors. Yes, we could use more money. But without even having those, by just taking away those obstacles that are within our grasp to change, we could make it better for everyone.
If you or a healthcare worker you know is in need of help, contact the Discovery Medical Students and Young Doctors Helpline. It's there to assist all medical students, interns, and young doctors with any mental health issue. This 24-hour service provides free telephonic counselling via a toll-free helpline 365 days a year. Contact 0800 323 323 and www.healthcareworkerscarenetwork.org.za.